Dr. Rao, what are the symptoms of chronic constipation?
That's a great question. For years, many of us, particularly physicians, have defined constipation as irregular or infrequent bowel movements. But we have now come to recognize that that is not the only criteria for defining a patient having constipation. We have now come to recognize that there are at least six common symptoms that patients present with. For example, a patient has to strain excessively to have a bowel movement. A patient passes very hard pellet like stools, or a patient has to use digital maneuvers to either take stool or support their opening areas to facilitate a bowel movement. Or they have this constant feeling that they need to go, although they've had a bowel movement, they feel incompletely empty. Or they feel there's a blockage in the anal region. Or they're having less than 3 bowel movements a week. Any of these six symptoms means a patient has constipation. And usually, most physicians and experts would use two of these six as a reason to call them as chronic constipation. So, these I think are the common symptoms that most patients with constipation have.
What symptoms should a patient be worried about and call their doctor about?
That's a great question. You should get really worried if these symptoms have suddenly come on rather than you've had it for months to years. Or if, in addition to these symptoms, you're having pain, particularly at nighttime, or you see a drop of blood, either when you wipe or when you see blood in the pan, or you actually feel that there is something growing or some mass or some bulge in your bottom end or in your belly. I think that is a cause for concern. If you're waking up at night with gas and bloating and distension, that then you should be concerned about this symptom. Or if you're losing weight with constipation. So these are all some of the concerns or alarming features. Particularly, patients need to pay attention if they've started a new drug or a new treatment. They may become constipated. No, they may have high blood pressure. They've gone to the doctor, doctor's made a good diagnosis, have treated them with a good medicine, their blood pressure has come down, but now they've developed a new symptom. So they need to be aware and tune into this possibility that drugs and medications can cause constipation, which is a common problem. Or they've developed a new condition, like their thyroid gland is not working or diabetes is happening. So those are all the things one needs to be aware of.